Dr. Waggel here, and I'm here with Riley, our very intelligent medical student who's going to be a physician. Next year, we're going to talk about the brain-gut connection. All right, Riley, would you care to tell our audience about the brain-gut connection?
Sure, absolutely. So the brain-gut connection is a connection between our brain and our digestive system. So they can interact with each other in a variety of ways. We're still learning about some of this, but what we found so far is that the gut is able to either produce by itself or stimulate production of certain neurotransmitters, such as dopamine, serotonin, or GABA. And this can have potential impacts on our mood, especially for people with mental health concerns. A study of 1,401 patients with depression found that supplementing and treating them with probiotics significantly reduced their depressive symptoms. So this might be something worth looking into for people that have mental health concerns.
Yeah, so the study that Riley's talking about is something called a meta-analysis.
Yes.
And a meta-analysis is where they take a whole bunch of research, and that's how they're able to look at a bigger population. So that's pretty exciting stuff. And so what percent of serotonin, which is a happy brain chemical for those that you are not familiar with serotonin, what percent is produced in the gut?
90 to 95%, so that's a pretty significant amount.
Thank you, Riley. That is correct. And where's the rest of it produced?
In our brains.
That is correct, Amungo.
Mm-hmm.
And I'm going to go over to the vibe board, and for my portion of the brain-gut connection, I'm going to be doing a little bit of drawing. Wonderful. The pink one selected. I'm going to draw the brain. It's going to be the best brain, okay? Use your imagination, okay? And then we're gonna do brown for the gut, if I can find. Well, this is as close to brown. So we'll do the large and then the small intestine. Okay. So we have the which nerve? So Riley's in the background. Do you know which nerve connects the two? Okay, so we have on old Olympus towering tops, a Finn and German viewed some hops. Do you not know this? This is the mnemonic for the cranial nerves. So which cranial? So
I have a different one.
Oh, what's yours?
The O to touch and feel very good velvet.
I guess it's a generational thing. All right, so
This is the vagus.
It's the vagus! Okay, very good. And, all right, so we have this connection here between the brain and the gut. So if we take like a cross section of the small intestine, y'all are going to just have to use your imagination. All right, we're taking a cross section, okay, up here. In here we have, what are these called?
Is it villi?
They're villi! Villi, okay. Okay. And then, to go even further, we're going to take a villi, and we're going to go here. And we have these epithelial cells called enteroendocrine. And the ones that connect to the nerves and go to the vagus are called neuropod cells. And so, when you eat, hold on, I'm going to do, can I do like a cheeseburger? I'm really having a good old, this is a cheeseburger. Okay, hold on, let me. You have, well, I guess this is like a kale burger because it's green, okay? So you have your cheeseburger, and it goes, and you get digested, and it gets absorbed in here, and then it goes through here, and then these neuropod cells send the signal to the brain, and it can send signals to the brain in about a second after you eat. So this is a visual of what Riley was talking about earlier. It's so funny. I'm gonna get better at this, I swear. Of how your kale burger can actually get to your brain. Yay!